If you're looking for a nursing job that is 100% stress-free, then this might not actually be the video for you, because to be quite frank with you, I don't think there's a single job in nursing that's 100% stress-free, but I will in this video show you 10 jobs that I think are at least like a little bit less stressful. Some of them I think are actually a lot less stressful than your typical nursing job. Hey, this is Thomas from Nurse Money Talk, where I help nursing students become nurses and nurses excel in their nurse career and nurse life. And like I already said, let's talk about some low stress nursing jobs. Now, I will caveat this by saying that I think, one, there's not really, like, you're not really gonna find a job that's 100% stress-free. Every job, whether nursing or not nursing, is gonna have some kind of stressors of their own. But what I am going to do in this video is specifically point out some nursing jobs that I think could potentially be less stressful to most people compared to other nursing jobs. And part of the criteria that I'm using, like when I was kind of putting this together, is that I was really looking for jobs that when I thought about like what typically causes a lot of stress, it generally tends to be dealing with acute problems, so acute patient problems, and dealing with just like really, really sick patients. Pretty much all these jobs actually are not gonna have any of those things. And then also I am gonna list the salary as well, which salary.com, PayScale, ZipRecruiter, those salaries were received I retrieved those from one of those three spots. So let's go ahead and get started. So number one is actually a nurse researcher, or you might actually call this like a nurse scientist. So it's pretty much like self-explanatory. It's a nurse that does research. So you're looking at various research projects that are typically funded by government or private grants. I think if you were really into the research papers and kind of like all that academic research paper writing side of nursing school, then this would actually be something that you might consider. So nurse researchers make about $86,110 a year. The second one is looking at camp nurses. So camp nurses would be nurses that work at day camps, summer camps as well. They primarily work with young children, teenagers. You will see them at adult camps as well. If you think about it, one of the things that actually makes this job, I think, less stressful, is that just think about the population that you're dealing with. You're dealing with typically a younger demographic, tends to be healthier as well. Especially if you're at a summer camp, they're probably not too sick if they're going to a summer camp. As a camp nurse, you're not really making a whole lot of money. It's about $44,309 a year. I think most of the camp nurses that I've seen tended to be LPNs as well. A couple of the experiences I did have with camp nurses, they called them camp nurses, but so they were like LPNs or RNs. And so and when I worked at a summer camp, the camp would have it scheduled to where like the nurse would come in and work for free for that week. And so in exchange for them working for free, their kid or kids or whatever could come to the camp for free and participate in all the activities. It's one of those things where like it did have its perk. It's obviously not the highest paying position by any means, considering on average LPNs make about, I want to say 45,000-ish or so. 45, 50,000, somewhere around there, and RNs are making somewhere around $73,300. So if you're looking at it, you are taking a pretty steep pay cut generally from being a camp nurse. But at the same time, I think you have to kind of look at it with some of the other perks as well associated with that. The third one I want to bring up is Lactation Consultant. I know a lot of nurses will get into this role, and so I think one of the things that makes this less stressful than your typical one is that, you know, generally you are dealing with a healthier clientele. Now, that's not saying you won't have some of the stressors related to just, I think, the whole pregnancy deal, and then especially if you're dealing with new moms, new parents, I think there's always, of course, a lot of stress associated with that as well. So if you don't know what a lactation consultant is, it's in a nutshell, it's a nursing professional that helps pregnant women or new moms just kind of in all aspects of breastfeeding. Lactation consultants make about $84,683 a year. So definitely check that out. And while I'm on that, if any of these jobs do seem kind of interesting or you'd like to check it out, see if there's any openings in your area, you can go to nursemoneytalk.com/jobs. Number 4 is looking at clinic nurse. You know, it kind of depends on where you're at. Average pay right here is $47,637 a year. And so I think if are you looking at the primary care clinic nurses, which I think a lot of them tend to be LPNs, but then you can get into kind of your specialty clinic nurses, which depending on how you want to classify, you could do a GI. I work in GI doing endoscopy, and technically I'm classified as a clinic nurse because we do run, it's technically a clinic. We run clinic hours, but it's a specialty clinic as well. It's definitely something to kind of keep in mind as you're looking for clinic nursing positions, because those will vary. But if you're looking at specifically primary care, if you think about the patients that you're typically dealing with primary care, they tend to be healthier compared to hospital patients. And so a lot of times in clinics, you're dealing with some acute things, but I feel like a lot of it tends to be more chronic than acute. So the next one is a public health nurse. You're looking at a state employee, and so make about $63,335 a year. As public health nurses, they tend to deal more so in promoting public health. So you're looking at education, some activism, some policy making as well, a lot of teaching associated with that. I would say you're probably doing more policy and education. And so if you think about what you're typically dealing with versus the hospital setting, you can kind of see how that job would be less stressful compared to the hospital job. Remember, based on the criteria that I originally outlined. So number 6 is the Nurse Informatics, and this one is kind of an interesting profession. I think it can be hard to really explain, but how I look at a Nurse Informatics, or the field of nursing informatics, is that the people in those fields, the nurses in those fields, they're kind of like the bridge between the people who write the codes and software that healthcare uses, or that nurses uses, and then the nurses who actually use the software itself. So you're looking at, let me see, $102,230 for a Nurse Informatics. So number 7 is school nurse. It's another state nursing position, makes about $51,315 a year. And pretty much as a school nurse, you're providing pretty much healthcare assessments, interventions, follow-up, and whatnot with children in the school settings. This could include situations of a physical, mental, kind of a social health. You can get into a family health deal as well if you really look at just kind of the holistic care of nursing. From what I've been told, because I do work with a couple of school nurses, is that they tend to have like several schools their school nurses for, and so then they kind of just take, kind of make their rounds within those X number of schools, especially as kind of like you look at budget cuts and whatnot. It doesn't look like schools actually have like, or a lot of schools have like a dedicated school nurse just that only works at that one particular school. Or at least the school nurses I've talked to, they've had multiple schools that they would make rounds to. Number 8 is a case manager. So an RN case manager, they make about $81,072 a year. And so typically in this position, I look at it more so of like you're meeting with people, or you're meeting with patients, you're making a lot of phone calls, and you're doing a lot of paperwork, or at least in my head, that's how I categorize it. So the case managers that I've worked with, so pretty much they're setting up a lot of follow-up care. And so, this patient's about to get discharged. So do they have an appointment set? By appointment, I mean like, do they have like a follow-up? So if you're looking at a situation of a patient that's discharging from a mental health facility, so do we already know which therapist? So they're going to set up an appointment with a therapist they're going to follow up with, a psychiatrist they're going to follow up with. If there's any issues with their medications, they could potentially do that. They could potentially also get in situations with insurance as well. If you enjoy the paperwork aspect or doing paperwork aspect of nursing, then I think a case manager would be something really to consider. Number 9 is a genetics nurse. And so a genetics nurse is a nurse that they've had special education and training to deal with in the aspects of genetics. So you're looking at situations where they're providing genetics education, providing nursing care, to families of patients and to the patients themselves. And of course, this is where it kind of goes back to the first one that I mentioned as well with the nurse researcher, because as a genetics nurse, you're potentially also doing a lot of research, specifically when it pertains to genetics. The genetics nurse makes about $73,386 a year. Number 10 is the nurse educator. They make about $76,591 a year. So this would be like your nursing instructor pretty much. So pretty much work in academia, may or may not do some research, write papers, scholarly articles, the whole 9 yards, and pretty much educate the next generation of nurses. One thing about this job though is just, I think dealing with students can be a little bit of a headache. But I think the nice thing about this position is that a lot of the typical headaches of teaching, which tends to be, in my opinion, it's dealing with kids that don't want to be there, and also dealing with parents. A lot of that you're probably dealing with less of that in this position. Like I already said before, you can find any of these positions by going to nursemoneytalk.com/jobs. Let me know what your thoughts are. Is there one particular job that sticks out? Is there a job on here that you think is stressful that I mentioned on here? Or better yet, do you have a nursing specialty that you think that is less stressful than some of these positions, some of these jobs that I mentioned here? Then go ahead and let me know in the comment section below. Thank you so much for watching this video, and I will catch you very soon in that next video.